recording. Just one moment. Go. All right. Can everybody see my screen okay?
Yes.
Perfect. And with that, I'm going to just hand it over to you, Hope.
Sounds wonderful. Well, let's call to order our March 2025 BHPAC Council meeting. And I will roll right into roll call. Okay, Aaron Black.
Present. I'm still trying to work on my my computer here. I might leave and re-jump back in to try to get my camera to work. Good morning.
Sounds good. Thank you. Good morning. Natalie Brown.
Good morning, everyone. Nice to see you all.
Good morning. Savannah Brown. Savannah Brown. Charles Davis.
Present. Good morning, everyone.
Good morning. Thank you. Carrie Eckert.
Morning.
Good morning. Sean Gartrell.
Present. Good morning, everybody.
Good morning, Sean. Kelly George.
Present.
Good morning. Lorraine Gilroy.
Present.
Margie Grimsley.
Present.
Morning. Rachel Horde. Rachel Horde. Danielle House. Danielle House. Stephanie Johnson. Stephanie Johnson. Okay. Chris Lobanoff Rostovsky.
This is Ben Nichols from DCJ, Director of Operations. I'm covering for him today.
Thank you so much. Megan is actually in Washington, D.C. today, so she won't be joining us. Sending her lots of good support and vibes today. We got Candace Ludwig. Candace? Dr. Asia Lyons. Sharon Mach.
Good morning. I'm present.
Good morning. Thank you. Michael Miller.
Good morning, everybody. I'm here.
Good morning. Phyllis Reed. Okay. Megan Shelton.
Sorry, my mute would not come off. Good morning, everyone. I'm here.
Good morning. Thank you. Mine gets stuck sometimes too. We love our technology.
I think it's my mouse pad. I just was not hitting it in the right place.
Well, good to see you.
Good to see you.
Dennis Streeter.
Present.
Thank you. Kristen Toombs. Kristen. Okay. Angie Wold.
Here. Good morning.
Good morning. And Annette Zacharias.
I'm here. Good morning.
Wonderful. Good morning. And I'll turn it over to our state agencies to introduce themselves. Start with the BHA.
Good morning, everybody. This is Caitlin Wong, the BHA Boards and Commissions Coordinator. And I will pass it over to Megan Schultz.
Good morning, everyone. I will introduce myself again. I know you just took attendance and I serve on the seat for the BHA seat for BPAC, but I am Megan Shelton, Director of Strategy Planning and Engagement at BHA, and it is so great to see you all this morning.
I am not BHA, but I'll go. I'm Bonnie Holiday with CDPHE. And for the purposes of this group, I'm your prevention technical assistance provider. So any questions you have regarding prevention, any resources that you need, I'm your point of contact.
Thanks, Bonnie. Sorry, it took me a minute to unmute in the awkward silence. I'm Brittany Noble. I'm with the BHA. I use she, her, they, them pronouns, and I'm one of our regional community engagement specialists. And I know Rachel is on here too, so I'll pass it over to Rachel.
Thank you, Brittany. I'm Rachel Simpson. I use she, her pronouns. I am the regional engagement specialist for the Western Slope. And I will pass it over. I don't think Judith has introduced herself just yet.
Good morning, everyone. My name is Judith Tiaku, and I am the manager for community engagement at BHA.
Are there any other state partners on the call today that would like to come off mute and introduce themselves at this time?
Hey, Caitlin, I don't think I fit that category, but I'm Ann Denton, and for the purposes of this call, I am your TA provider for Planning Council operations.
Hey, Ann, I didn't see you sneak in there. Happy to see you today. Right, well, with that, we're going to pass it back over to you.
Okay, thank you, everybody. Thank you so much for being here. So jumping right back into our agenda, we have a recap of our discussion last month of rural and frontier funding and program access. That was a wonderful presentation from Mark with statewide programming. I just wanted to open up the floor to see if there was any feedback, questions that hopefully can be answered here. Just to open up for any discussion that anyone might have based on what we learned last month.
I am also dropping the slide deck link into the chat so everybody can go in and take a look at that.
Hope?
Yes.
I think we need to review the minutes and vote.
Oh my gosh. Thank you so much, Lorraine, for keeping me on track there. I just jumped. Thank you. I got so excited to keep going, but we got to take care of business first. So thank you. I hope everyone's had a chance to review our February minutes and looking for any corrections, updates that anybody saw. Thank you so much, Lorraine. Appreciate you.
I would move that we adopt the minutes for the February 6th meeting,
I'll second.
if that's the correct date.
Aaron Black seconds.
Wonderful. Thank you. The February meetings have been approved. Gosh, thank you, Lorraine. It takes a village here sometimes, right?
Yeah, don't worry. No sweat.
Thank you. Okay, so business, that business has been completed. We'll go circle back to any discussion we might have regarding the presentation last month.
I just wanted to, remind everybody, we really want to take this time to be able to provide some additional feedback and ask some additional questions about the presentations that were given previously. What I am doing with all of this information is I'm sharing it back with our presenters so they can either follow up with you all regarding questions, or if we see, some additional trends and some of the discussion items and things like that, we can really highlight for them to either be able to come back and speak with us and incorporate some of our suggestions and things like that. So really just want to kind of hold this space for you all to be able to discuss and debrief as a council.
And Caitlin, I'm assuming, this isn't it, but I'm assuming that we're going to opening all these places up, and with these 6 mobile units and stuff, this is huge access and reach. So we'll, it would be great for us to have follow-up sort of data about how well they're being utilized, and is the word getting out among these rural communities to go there and that they're safe places to go for care. I would love to see how much they're actually serving and, sort of the return on investment.
Absolutely.
And I guess I should say that, I think this is terrific. I just want to make sure that we're getting the word out to everybody who needs access. And if we're not, then how do we help get the word out better? And that's really what I'm looking for data. I'm not saying that, we need data so that we can shut it down. I'm thinking that we need data so we can spread the word larger.
And to help understand how it's being marketed and how information is being provided, like you said, to ensure that the word is getting out, and how we could be of support in that process. That's a great suggestion, Annette. Thank you. Charles.
Yeah, I wanted to, and Megan might be able to help more with this, but I became aware that we have an ag behavioral health program going on in the rural and frontier areas that I attended for the first time last week. And I don't know if that's because it's ran by the Department of Ag. It wasn't included in this, but I think it's an important component for the rural and frontier communities. And it covers mental health and substance use disorders.
Charles, are you referring to the work group for Senate Bill that came out of Senate Bill 24055?
I believe so.
Okay, so I can speak a little bit on that. So that legislation created a work group between the Department of Agriculture. They run that work group. BHA is part of it. And then BHA is tasked with developing a program and an engagement plan for specific to agricultural and farming communities. And so I don't know if she's on here, but we have Calandra Lindstadt within our community engagement team. And so she is currently working on developing a program, and then she will develop an engagement plan specific to that work. So she's the BHA representative on that work group.
And Megan, what is this work group specifically for rural and agricultural communities?
Yeah, it's for behavioral health for agricultural and farming communities.
And will this just kind of identify the needs? Or is this going to be able to provide services?
So it'll develop a program that then is a way of engaging, a way of helping people get the services that they need when they need them, really getting into our agricultural and farming communities and addressing the barriers specific to those communities. We know that those communities have higher suicide rates than other communities. And it's often, there's a lot of access issues, as well as cultural components to getting the services they need. And so it's really all comprehensive. And Caitlin, I can send you the link to put in the minutes, and I'll share the link in here too, for more information. Yeah.
Thank you.
Mm-hmm.
Tosh.
I was just wondering, would you like me to put the website on there and the information? Because I do have a card for that.
I'll put it in here, Tasha.
Okay. All right. Sounds good.
Thank you.
Does that program also include the work that Colorado State University, the extension office, is doing in relationship to this? Their Representative John Capalis, one of the Larimer County commissioners, sent me a video that talks about the legacy mental health agriculture program. And so they have clinicians that go to the farms and then do counseling to the farmers right there on their property. Is that part of this program? And I'm happy to share that video if people want to watch it. It sounds like a pretty cool program. So I'm just curious if that's all part of this work that the state's doing.
I would imagine that it is, but I cannot say for sure. But I can follow up and see if it is.
Well, I'll send the video link to
Who did you
Caitlin.
say it was? It's CSU Extension, but is there a person, who's the person leading it?
Let me look at her name again. Carrie Rollins is the regional director of the Front Range Region CSU Extension. And so Mental Health in Colorado's Modern Day Agriculture is the name of the video that was created. I'd have to watch the video again to, remember all of the background, but I'm happy to share the video if you all want to watch it.
Yeah, if you could share the video, Natalie, I can send that out in our follow-up email. When looking at the slide deck, are there any other thoughts, comments, questions?
I know that it was briefly touched on the Colorado crisis line. There was some issues that were brought up in the meeting, and just we have a new provider of the Colorado crisis and support line, and being out of state, just some of the issues that were presented. I think it would be interesting to hear what's kind of happening around that, what I don't know, different maybe procedures are being put in place, how that's working, having a out-of-state provider handle our crisis line So I know it's new, but maybe down the road we could learn how that's working, kind of get an update around that.
Absolutely, Hope. I think that's a great idea. And then I can also share with this group that we just posted the position for the director of Colorado Crisis Services at BHA. So I can put the link in. I put the link for the website for the ag work group, and then I'll put the link for that position also. If there's anyone that you think may be interested, would love for you to share it out with your networks. And then I think Hope down the road, definitely having someone from that's really involved with that work coming in to answer more detailed questions and give more information.
And I know that Mark had sent a follow-up email that I was CC'd on, but we hadn't gotten a response. So I'll go ahead and follow up with them after this meeting today to see if they can provide us with some additional written information right now. And then depending on, you know, how they answer some of the questions and things like that, if we need to bring them in at a later date and time for like a presentation or like a meet and greet and stuff like that, we can absolutely do that. And looks like Natalie linked that video in the chat, everybody. So with that, any other last minute comments, questions, concerns, thoughts?
Okay.
I just thought that it was nice to get that information with the target demographics being different than what I usually see. So I appreciated it.
Hey, Clarine.
All right. There's no further discussion. We'll move right along here to our BPAC business and our behavioral health best practices podcast updates with Dennis Streeter.
Good morning, everybody. Got a lot going on, so I'll talk fast. First of all, Margie Grimsley is going to do a presentation next week on the new and improved SAMHSA system of care concept. And she's going to give kind of a parallel comparison to what it started out in 1992 to where we are today with the system of care. And that's, like I say, Margie's going to be making that presentation with me next week. And then we're going to have some follow-up presentations relative to this, talking about the lawsuit against the state on Medicaid implementation of the system of care and the settlement that was agreed upon. And we're going to start tracking that much more directly. So I'm pretty excited about that. The other thing is Congressman Jason Crow has agreed to sit for an interview with me to discuss issues of behavioral health impacting combat veterans, PTSD issues, etc. And those that know Jason Crow know that he is a combat veteran himself. And that is one of his real passions in representing the veterans community. He's also going to be giving updates on the Medicaid crisis that's coming out of Washington, D.C. He's going to campaign heavily in the House to save Medicaid from the cuts that are coming. But he's also going to be able to discuss the impact if cuts are made and how that's going to work. So I'm pretty excited about that. Senator Mickelson Janae is going to be on for another interview later this month, and she's going to give updates on, again, a lot of children's mental health issues that she is working on with her coalition, Behavioral Health Coalition, in the state Senate. So I'm again looking forward to that. I tomorrow am going to be talking with State Senator Michael Wiseman. He's ready to put together an interview with me about judicial reform on the state level relative to behavioral health issues, particularly mental health issues with nonviolent offenders, to try to put together legislation that will have treatment as opposed to incarceration. So that I'm really looking forward to that. And he's got some, as an attorney, he's got some strong opinions about the reforms that we need in our judiciary. So we're going to be looking forward to that. Another really big interview coming up in April will be with the Community College of Aurora. They have a behavioral health program, and it's part of their Pathways program with the CU Anschutz Medical Campus, where people will get 2-year certificate, or not 2 years specifically, but certified in behavioral health, tech issues, etc., but be able to transfer directly into the CU Anschutz programs to be able to get undergraduate, bachelor degree, as well as advanced degrees. This Pathways program is really, really something to be excited about. And it could very well be a good pipeline to get qualified workers in the behavioral health field. So we're going to be looking at that. I'm also working to get an interview with Attorney General Phil Weiser about the opiate settlement that he negotiated and how the funds are being used in prevention statewide, and how that is all going to be moving forward. So again, that's a little bit down the road, but pretty much have a commitment to be able to do that as well. Again, I'm very interested in topics and presenters, whether it's individual presenters as advocates or organizations that are working in the behavioral health field. So I'm going to again invite any and all members of our council to give me any topics and people that you think would be effective in putting this information out to the public. Now, one last thing is this afternoon I have a meeting with the Director of Community Outreach and Engagement at the CU Anschutz Medical Campus, where they have an initiative to explain medical issues to the public throughout the state of Colorado. And I'm going to be talking with them about the behavioral health component for that. And if that collaboration comes together and they seem pretty excited about the possibilities, that will be another opportunity for BPAC to have direct impact in what's going out to the public that we're supposed to be advocating for. So I think that can be an absolute wonderful outlet that has a lot of credibility. Beyond that, I'll just I'll email everyone when Margie's presentation is up so you can go and watch that. I am also, along with these legislators that I'm talking with, but also other advocates, looking at forming an information coalition on behavioral health, where people will be able to share information on innovative practices in the behavioral health realm that they are currently doing and ways of promoting what good's being done and have it hopefully more centralized. So again, that's something that we hope to develop over the next couple of months. But any member of the council will be invited to join to whatever degree you want and help get information out to the public in general. So that's it. Thank you for your attention.
Ms. Hope,
Yes.
first of all, Dennis, I think that was wonderful. Without lobbying, because I don't think our group lobbies, but with Congressman Crow and his activities, I think we could help him educate the public about what Medicaid does, because I didn't know Medicaid helped my dad's nursing home stay afloat because he had Medicare. I thought Medicaid was if you were younger.
Yeah,
And
that's the biggest funder of
right. And
long-term
so
care.
right. So I think if we each had an experience like that, we could forward it on to Congressman Crow just so that he can use that along with whatever other stories he's getting and information about finances. I think the individual stories can be very powerful. So
Yeah.
thanks for letting me interject, Dennis.
Yeah, I love what you've said, and I want to emphasize again, as I asked for information and ideas from you guys. You now have a general idea of who's going to be on short term. And again, Clubhouse is still going to be on. We still have to work out some scheduling on that. But if you have questions for Congressman Crow or Senator Wiseman or Mickelson Janae, get me the questions because again, I will be able to work this in with them so that these will be even more impactful. So keep that in mind. And again, I'm going to put my website, which will explain the initiative, as well as my email address in the chat. So I hope to hear from you. Thank you.
That's such a wonderful idea, Laureen, and I thank you for proposing this. And I think with your support, Dennis, in asking for this information from us, I'm hearing it's stories and questions that you'd be willing to compile those for the council. And so did I get that right? I just want to make sure before
Yeah, yes, Hope, and you and I
Okay.
had this conversation where you kind of take the lead in leadership in trying to get the BPAC much more involved in the community on the community side along with me. So I appreciate you.
Well, thank you. And we all so much appreciate you and the hard work you're doing and support here, Dennis. And I guess what would be helpful to know is when is a deadline? When would you like us to submit our questions or stories, like you suggested, Laureen, so we can contribute?
Actually, this is going to be ongoing. And again, people are being invited back. And again, recommending guests that you think would be particularly effective in presenting the story of their organization and what they're doing. This is not a finite thing. This is going to be an ongoing podcast. And again, it's like I told you in our last meeting, nobody says no to me And especially as the higher profile guests I get, they want to be a part of this. So we will have the venue, and it'll be up to us as BPAC to get this out to the damn public. The public needs to know, and so we all have networks to be able to shoot this out and have people understand it. And just so everyone here understands, I try to keep these interviews at 15 minutes or less so that it's not a burden to watch it. You know, these hour programs and everything are great, but, you know, so this is much more of an overview and a way for people to know how to get more information beyond what the guest is talking about. So keep that in mind. And like I say, man, I welcome all comers, and it will be ongoing.
Thank you very much for that, Dennis. And we got to keep moving on here, but Tosh, I see your hand is up.
I just want to know right quick, is that like stories about pretty much where we've come from using these services and how it would impact us if we lost them from the community? Is that what I just need a little clarification on that, sorry.
That's what I was hearing.
Yeah, you know, and look at this as a hybrid. This can be whatever we want it to be. Like I say, Margie has done an interview with me about the Colorado Federation of Families for Children's Mental Health. She's coming back and making a presentation, which will be a PowerPoint. You know, and again, the anecdotal approach is particularly effective. So to put together a program about a specific issue within the behavioral health realm, we can do it. We can do it any way we want. And that's the beauty of being able to do these style of podcasts.
Thank you. Awesome. Okay. Looking for our CCBHC update.
Sure, I can provide a brief update on that. So CCBHC is certified community behavioral health clinics, and I will put a link for more information. So what I can share with you is that in September of 2024, the Department of Healthcare Policy and Financing, in partnership with Behavioral Health Administration, submitted an application to SAMHSA for the 2024 Certified Community Behavioral Health Clinic Planning Grant. And SAMHSA awarded that to us the end of December. This is a one-year planning grant that will provide federal funds to support Colorado in developing a model that will benefit communities and people around the state in need of behavioral health services and will strengthen the provider network. The grant will also support Colorado in preparing a proposal to participate in a 4-year CCBHC demonstration program that will begin in January of 2026. So this is more, it's more than just, these are more than just clinics. They are more like safety, comprehensive safety net providers. And we will be, BHA will draft this into our rules. We'll be holding engagement sessions to provide more information as we move further along in the process. And I'm going to put a link in the chat from, I just lost my link, from HCPF's website that tells more. And then they are starting some engagement sessions. Their first one is the end of March. So that might be a really good place to start to learn more about it as well. And then I think as we got further along, this would be a really good presentation. And oftentimes when we do community engagement, one of the places that we make sure that we do those is during our BPAC meetings. And then we also do it during our BHAC meetings. So we're really sharing out all of that information with you all.
Will you also share what the acronym stands for again? Because it's escaping my mind.
Yes, Certified Community Behavioral Health Clinics. It's a long one. I don't know why it's hard for me to say CCBHC for some reason. I'll get used to it.
Certified Colorado Behavioral Health Clinics. Okay.
Certified Community Behavioral Health Clinics.
Community. See?
Uh-huh.
Okay. That one's going to take a minute, but we'll get there.
We'll get there. I think, honestly, we'll be talking a lot about CCBHCs in the future. So, and I see Ryan's hand is up. So Ryan, I'll pass that over to you.
Thank you, Megan. So Ryan Templeton, Legislative and Governmental Affairs Division Director with the Behavioral Health Administration. So I'm one of the 3 staff at BHA assigned to take on BHA's role within the CCBHC, or the Certified Community Behavioral Health Clinic planning grant process. This is predominantly driven by healthcare policy and financing, but in close collaboration with the Behavioral Health Administration. So what the planning grant is, it's the 1 year, 2025 is our year to get everything in Colorado set up for, like Megan said, to submit an application for Colorado to become a demonstration state. So what a demonstration state means is that we would have 4 years to show that, hey, this is a good model. Like, there's providers meeting our new regulatory requirements, there's new data reporting requirements, there's a new payment system for these types of clinics, which I think clinic is maybe a loaded term in this sense, right? They provide a whole ton of service delivery, and it's just a different payment model that the federal government is supporting. Megan shared with you that CCBHC website that HCPF has. There's a ton of fantastic resources in there. One of the resources that BHA is working off of closely is the SAMHSA, Substance Use and Mental Health Services Administration, right? Where also the state law that establishes BPAC, or not the state law, the federal law that establishes BPAC comes out of SAMHSA or is administered through SAMHSA as well. So they are responsible for the CCBHC requirements. There are specific pieces that CCBHCs need to meet, and that the states, Colorado, has to establish the criteria. You may be saying, hey, Ryan, but aren't there some CCBHC demonstration sites? Yes, there are some in Colorado already. Those are individual sites that have moved to a spot of individual site demonstration. We are doing this as a state, or at least planning for doing this as a state. One ask of BPAC is how would you all like to be informed on this? Megan had talked about there's a whole regulatory process, and as a lot of you know, rules at BHA and rules across the state take a long time. We do not have a long time to do this. We have to have rules effective by January 1 of 2026. So what that essentially means is between now and the summer, we are drafting and stakeholdering rules. It goes through the same process of going to the State Board of Human Services. So what we're looking for is really the fall. October, November is when we're at State Board of Human Services. That State Board of Human Services adopts the Colorado certification of these types of providers. To get to that January 1, 2026 effective date, we have to have rules in place in order for us to submit the application to SAMHSA for us to become a demonstration state. So I see that got some hands raised, but I hope I'll kick it to you to.
Sure. I think I saw, I'm sorry, I think I saw Nat's hand up first.
Thank you. I guess, Ryan, to speak to your question, how do we want to be updated? I guess I would request that we receive a regular update monthly on how things are looking, since you all are moving so quickly. I would find that really helpful. At a quick glance at the website that Megan just shared, is it correct to say, or fair to say, that this is essentially going to help expand Medicare coverage for behavioral health services beyond just like clinical treatment services? Is that something that is fair to say, or no, am I not just at quick glance reading into it too much?
So not Medicare, it's a Medicaid type of payment. So there's really 3 big things, at least this is kind of how I see the planning grants. We have to set up a certification process, right? So how do entities become CCBHCs in Colorado. So that's a regulatory process that we as BHA are responsible for. The second one, there's a whole bunch of additional data requirements and metrics for these types of providers to show that they are successful. And that's part of the setting up the state to show that we are set up to become a demonstration. So that is also a BHA responsibility, is what are all those data metrics? What are all of the things that those providers have to report on? How are we ensuring that there is quality and access to the services that those providers provide? And then the last one that is really healthcare policy and financing, our Medicaid authority in Colorado, is the setting up the payment structure for these types. If we were to get or become a demonstration state, there's additional funding that comes to Colorado for this specific model and these specific types of providers that runs through Medicaid. So it's setting all that stuff up for the 2025 year to get to that spot of submitting a pretty large application to become a demonstration state. But it's a state-run Medicaid kind of offshoot model.
Thank you, Sean.
So this CCBHC is meant to replace the community mental health center system, is sort of, or?
I wouldn't say replace. I think there's an opportunity to see if it fits what Colorado is trying to do with a reformed behavioral health system. I think one of the tasks that when BHA was created and through the task forces that worked for years to get to where BHA was created was coming up with what are some alternative funding streams to support a larger system within Colorado that supports more people in the right spots at the right times. I think this is an opportunity for Colorado to explore. Does this fit? Does this fit within what Colorado is trying to do? So I don't think it replaces the community mental health centers. It also adds a whole bunch of additional requirements that include substance use disorder service delivery. And there's a lot of requirements about just recovery support service delivery. It includes requirements for how are you connecting people with housing, individual placement and support for employment for individuals, as well as very specific requirements for just more of the general recovery support service delivery. It's also not just individual providers, but also designated agreements with community about how do all of the services happen within locations that these CCBHCs are across Colorado. So I think within that, I think it's a larger opportunity to potentially look at how another type of provider fits in. I will say this does not replace the comprehensive behavioral health safety net provider, which is a state requirement for Colorado, and it does not replace the essential behavioral health safety net provider that is also a state provider type for Colorado as well. So it's looking at how does this fit into the larger structure of what the state of Colorado has put into place.
Counselor Black.
Thank you so much. Thank you for the information, Ryan. I'm just wondering, so we're going to be having many more requirements for our service providers. Some of these agencies are for-profit, some are nonprofit, correct?
So to be clear, this will be an opt-in for entities looking to pursue. It's not a hard and fast requirement for everyone.
Okay.
It's a choice for an entity to pursue this type of certification.
And are they part of this process coming up with, coming up with this? Are they part of this whole discussion, the providers?
Yep. So part of the planning grant application that the state of Colorado through healthcare policy and financing submitted to SAMHSA was kind of a layout of 6 specific things that the state of Colorado said that we would do. One being is that there needs to be a gap analysis about establishing or identifying what our current metrics and comparing those to how the CCBHC federal metrics align or don't align to identify what does the demonstration project need to identify to start to fill those metric gaps. Second one, which we talked a little bit about, is the certification process. Colorado has set up that certification process. The third piece in there is that it's formally conduct stakeholder engagement with people of Colorado, including specifically Medicaid members, as well as provider groups. So it really doesn't work for Colorado if we have, hey, we set up this whole structure, but there's no providers that want to do this, right? So it is a partnership with both individuals with lived experience, family members, Medicaid members specifically, because this is a part of a Medicaid program, but also it's a background for ensuring that providers are knowing what they're going to be signing up for and making those business decisions to do that.
Sure. And as far as resources that providers that they're going to have resources to do this, just like if they're accepting opt into any grants, contracts, agreements, will part of this, will there be funding or resources available so they can meet these requirements? Because I know from a grantee perspective, boy, they're just inundated with reporting and all this. And so I'm just wondering, I want to make sure that we support our providers through this.
Yeah, I appreciate that. Part of setting up what is the prospective payment model, which is referred to as a PPS funding model, is exactly that. What is the cost of providing all of these services that maybe have not traditionally been even a reimbursed service delivery, and how is that cost being identified and opportunities for that type of reimbursement to make sure that these are services that can continue? That is part of the demonstration. If we were to become a demonstration state, that there's the extra dollars flowing from the federal government to support that PPS or that prospective payment system model for these types of providers.
Great. Well, I appreciate that. Thank you so much.
Yep.
This is really helpful to kind of start wrapping our brains around what this means. And I think as far as our contribution and what we're seeking as a council, it'd be helpful to have an opportunity to come back and talk that through. And I'm to make a motion to add this to our agenda so we can keep this discussion going and learn the best way that I think as the BHA is seeking to this year and all the rules and regulations that you can tap into the expertise and experience of this council to support that. So should I make a motion to add this to our next agenda to keep this
This is
conversation going?
Natalie, and I'll second that motion.
Wonderful. Okay. Thank you. I know we have a really important presentation to get to today. I also want to create space because I know how helpful it is to kind of take a break, reframe. So let's do like a quick 4-minute break and come back at the top of the hour to jump right into our block grant funding with our data and fiscal team presentation. Sound good?
That's good.
Okay. See you in 4 minutes at 10 o'clock. That was a quick 4 minutes. But it is 10 o'clock, everybody.
All right. Kasha, I have made you co-host. Are you able to share your screen?
Yeah, I think so.
Right, perfect. Let's see here. Can everybody see Kasha's screen or just mine still? Perfect. Okay.
All right. Morning, everybody. Thanks for having me. Caitlin provided us with your letter of recommendations from last year, and I'm here to talk about the request to understand how block grant funds are allocated, who they're allocated to, how the funds are being tracked, managed, and spent, and the outcomes of the services being accessed. So let me get rolling here. All right, so here's just a quick agenda of what we'll be talking about this morning. We're going to start with talking about how we're establishing budgets for the block grant, how we monitor expenditures, a little bit of information about the annual reporting, touch base on the intermediary system, and then I'll provide a high-level expenditure summary and then a detailed summary of what vendors receive block grants funds and for what purpose. All right, so establishing block grant budgets.
Everybody, sorry, I just got a chat saying that we still see the agenda. Is everybody still seeing the agenda or are we seeing the slide deck?
Slides.
I see the slide.
You're seeing the slide? Okay.
I only see the agenda.
Okay. Kasha, do you mind if I just share my screen and then I can just scroll down for you?
Yeah, let me put the presentation in chat. Give me 1 second.
Okay. Sorry about that. I just want to make sure everybody's on the same page here.
Give me 1 sec. Coming your way. I added a couple of pieces of information this morning, so I put the presentation in the G chat.
Sorry, everybody, just stick with me 1 second. Okay. How's this look? Can everybody see? Give me 1 second.
Looks good to me. This is Annette.
Thanks, Annette. All right. Okay. How's this look, everybody? Doing good? Okay. Kasha, take it away. Sorry about that.
Would you skip to slide 4? Thank you. All right, so the budgeting process to set allocations for using the block grant funds is a collaborative process between the fiscal team and the program team, so we can prioritize the funding with the most critical community service needs while maintaining compliance with the block grant regulations. So the fiscal team and the program team determine the amounts that we need to continue forward from the previous year to continue those essential behavioral health services. We determine any administrative or system development costs, which include staff salaries, data infrastructure, needs assessments, and the consumer surveys that are required by SAMHSA. Once we have all of our essential services covered and our administrative and system development costs covered, then we make sure that we're adhering to any set aside requirements or any other compliance requirements. And then any remaining funding is prioritized typically for priority populations or the set aside services that SAMHSA requires. Next slide. So once we put the money into contract and we start receiving invoices for services, we have a multi-step process for processing those invoices. So once the vendors have the services provided and get their invoice ready, they send it to a centralized invoice or centralized invoicing inbox. And then the invoices are routed to the program manager who oversees that program. The program manager completes an initial review to ensure the alignment with the contractual requirements. And then once the program managers indicate that the invoice is approved, then the accountants complete a secondary review to ensure that the invoices are financially compliant. And then the accountant tracks the invoice and sends it to CDHS for review and approval and payment. So CDHS is the agency that processes all of our invoices and sends the payment to vendors. And CDHS provides oversight of all of BHA funding sources. CDHS has an audit division that provides special reviews, internal audits, and acts as a liaison with external auditors. When the program managers are overseeing their contracts, they meet with the vendors regularly to monitor contractual compliance. They conduct fidelity reviews with providers, and they provide technical assistance to their providers as well. And I see Marjorie's question in the priority population. SAMHSA determines the priority populations for the block grant. So the priority populations for the mental health block grant are individuals with serious mental illness and children with serious emotional disturbance. And the priority populations for the substance block grant are, let me see, prevention, women and people with dependent children or people who are pregnant, intravenous drug users, people with tuberculosis or at risk for tuberculosis. And I think that's it, but I'll have to check my other notes. Just off the top of my head, those are the priority populations for the block grants. And Anne asked how providers are selected. So our providers are selected through a competitive procurement process. A lot of the funding goes to ASOs, MSOs, and CMHCs, which have been procured through state fiscal rules. And next slide. All right, so with the annual reporting, BHA is able to provide information about funding allocations and the general services made available through the funding. But as of now, we're unable to track individual outcomes by funding source. So we can't say, oh, this person was funded with block grant and they had a successful discharge and here's their quality of life improvements. It's more of it's like more of a global view where we're evaluating across all funding sources, but we can't tie outcomes back to block grant right now. The annual substance block grant and the mental health block grant reports contain the required information that we have to provide to SAMHSA. And I provided the 2024 reports. There's links that you can click on to take you to the report. The 2024 reports were submitted December 2023. The 2025 reports were submitted December 2024, and those are pending approval still. So those reports are pretty lengthy, and I've looked at them like, I don't know what to make of this. So we're currently having some planning discussions with the data and evaluation team and the fiscal team to figure out an annual process that we can employ to summarize the information contained in the reports and highlight any trends for the BPAC. So I wanted to provide those reports. I know they're not very accessible, but we recognize this and we're working to figure out what does an annual review of our data look like with BPAC. Next slide, please. Okay, so I know that y'all met with Mark Conajani last month, and he talked a little bit about the rural services that are being provided. So I'm going to kind of build off of what Mark presented and bring it into the block grant context. So we're just going to do a quick little overview of our intermediary system and how block grants is supporting that. Next slide, please. So until June 30th, our MSOs, managed service organizations, are implementing substance use disorder services within the state. And some of the items that block grant funds with our MSOs includes the involuntary commitments, MAT, withdrawal management, OD prevention, inpatient or residential and outpatient treatment, women's treatment services, which is one of those priority populations. We support recovery residences through MSOs with block grant funds, as well as recovery support services and peer and care navigation services. Next slide. Within the ASOs, the administrative service organizations provide the full continuum of crisis services throughout the state, and block grant funds within the ASO contract support mobile crisis response, crisis walk-in centers, crisis stabilization units, acute stabilization units, and crisis response teams. In addition to those core crisis elements, block grant funds have also been used to support the Colorado Crisis Line and the 988 line. Next slide. So the community mental health centers, CMHCs, they provide mental health safety net services to folks who are underinsured or uninsured. And block grant funds support safety net services, including emergency and crisis behavioral health services, outpatient services, high intensity outpatient services like assertive community treatment or ACT, case management, outreach, education and engagement services, and mental health recovery supports. And I'm looking at the top of the question from Tasha. Is there an accounting from these companies on the use of mental health block grant? Is accountability maintained? Yeah. So the program teams, in response to Tasha's question in chat, the program teams oversee the contract with the ASOs and have regular meetings with them to talk about what the services are that are being provided and the number of folks served. That might be a good follow-up question for the program team, but the program teams are monitoring the contracts and the services being provided. Next slide. So as y'all know, we're moving towards the BOSO implementation on July 1st. So I put the little BOSO map that I know you've seen before, but just wanted to highlight this because our reporting, after BOSOs are implemented, our reporting is going to look quite a bit different because we'll have less recipients of funds. They'll be primarily funneled to the 4 BOSO regions. So funds that used to go to the ASOs, MSOs, and CMHCs will be transitioned to the BOSOs. Next slide.
Tasha, it looks like we have a question in the chat from Kelly George.
Yeah. Kelly asked if there are any check-ins with individual members who are using the services to verify the effectiveness. So one of the block grant requirements from SAMHSA is to conduct an annual consumer survey. So we have contracted with a data and evaluation firm to conduct a consumer survey that is in the works right now. The results of that consumer survey will be incorporated into next year's block grant reporting. And those surveys go directly to the recipients of the services. So now that we kind of set the stage with how the funds are being used within the intermediaries, I'm going to dive into just a really high level overview, and then we'll get into the individual recipients. Next slide, please. So this is how the state spent substance block grant funds during state fiscal year 2024. So out of the 30 million that we spent, 71% went to treatment and recovery services, 23.9% went towards primary prevention, and 4.9% was spent on administrative categories, which includes staff salaries, the consumer satisfaction survey, statewide needs assessment, items like that. I'm looking at the question from Lauren. Oh, I lost it. Where'd it go? Does Colorado have inspectors general or similar people who are independent? I don't have an answer for that. I'm not exactly sure how that comes together. Sorry. I do know that we have external auditors that, like, we just had an audit for the use of mental health block grant funds, but I'm lacking the knowledge of how that comes together. I just know that CDHS emailed us and had us provide a bunch of documentation for the auditors. I can follow up. Caitlin, if you wouldn't mind taking note of that question, I can definitely route that to our CFO and see what information we have for that. Next slide, please. This is.
I was going to say, if I make right quickly, it's not that I doubt you and the other folks who work for the state. I just think that we may have to be more aggressive in demonstrating that we are good managers and caretakers of the taxpayer dollars. And so I'm looking at what information we collect now that we might be able to use. And I didn't want to duplicate. I didn't want to think about it anymore if I didn't have to. And if there's inspector generals, then I don't have to think about it. But I just didn't want to be duplicating things either. That's what I'm getting at.
Thanks for that additional context. I appreciate it. Okay, so for mental health block grant in state fiscal year 24, out of the nearly 20 million spent, 53% went towards outpatient mental health services, 26% went towards crisis, 12.2% went towards first episode of psychosis programming, and 4.7% went towards administrative costs. Next slide, please. Okay, so now we're going to get into the individual vendors and the amounts. I put little brief descriptions of how funds are used in the charts that I'm going to show, but I encourage you to reference back to the other slides where we talk a little bit more about the services provided. There was a lot of information and I was having a hard time making it digestible on a slide. So next slide, please. So for the substance block grant, here are the vendors who received funds in state fiscal year 24. And I put notes about how they were used. I don't know that it's necessarily going to be very helpful for me to just run through this line by line. But in a nutshell, most of the funds went towards MSOs. And we had a good chunk go to CDPHE for the 20% prevention set aside. And then we had some smaller contracts in there to provide things like peer credentialing through the Colorado Association of Alcohol and Drug Service Providers. I'm just looking at chat here. Yeah, we could definitely go back to the slide with the pie chart. Bonnie, were you wanting to see the scepters?
Oh, and actually, it looks like someone will send out the slide deck at the end, so then I'll have all the time in the world to digest. That's very appreciated. So
The slide deck
no
is
worries about it.
also hyperlinked in the agenda that was sent out last week, but I'll forward it back to you, Penny. And is this the pie chart you wanted or the other? This one, the scepters or mental health?
It was this one, but I don't want to derail the whole thing. I can go to the link that was so kindly provided.
And I see Tasha's question. Yes, the services include children and youth as well. So I know this is a lot of information to put on a slide. I think if y'all review this and you have follow-up questions, please feel free to route those to either myself or Caitlin, and we can hunt down answers for you.
Yes, I definitely encourage people to take some time between this month or between this meeting and our April meeting to really do some deep dive into these slide decks and take some notes, because this is, our primary focus of this council is regarding block grant funding for the state of Colorado. And so during our recap and discussion in April, I think it would be really beneficial, the most questions that we have, the most comments, everything like that we can provide to Kasha to get that clarification on is only going to strengthen us as a council. So I highly encourage you to really take some time, write down some notes and things like that to become prepared for April. And Kasha, it looks like we have a message in the chat from Anne.
Yeah, let me follow up on that one. I know that the contracts team has a list of all of the ASO, MSO subrecipient or vendors. So let me dig into that one. And Caitlin, I'm so sorry. I'm not keeping track of the questions.
I got them written down. Yep,
Okay.
and I'm tagging you in them. So yeah, no worries there. We got it.
Perfect. Thank you. Can we go to the next slide? So as you can see, the mental health block grant had quite a few more recipients of those funds. The contract value is smaller, so it's money split across all of the FEP sites. And there's, let's see. Yeah, a lot of the funds are used for FEP here. And we've supported some of the crisis continuum with these funds. I know that Colorado Mental Wellness Network is operating quite a bit of peer support and training. We have a fair amount of money going to the Department of Local Affairs to help folks navigate tenancy support and get access to housing. I think that program targets homeless folks experiencing homelessness and an SMI. Some of the funds have gone towards safety net services at community mental health centers. We used some of the funds to support the crisis call line that was previously administered by Rocky Mountain Crisis Partners. The vendor for those services now is Solari. And we use some funding to provide technical assistance to the FEP providers. And some funds go towards Momentum, which is a program that supports individuals transitioning out of hospitalization for mental health concerns. And yeah, a lot of FEP, a lot of crisis, and a couple of others sprinkled in there. So again, heavy slide with lots of information, but please review this and follow up with questions that you might have about that. And that's kind of all I have for you today. I just wanted to thank y'all for providing that really robust letter back at the last application. It was really helpful to see where the gaps are and what information folks are looking for. And trust me, we're working on pulling all of it together, and your information has helped us recognize some gaps. Like, for example, just giving you guys the annual reports, but not kind of summarizing and highlighting the trends. So we appreciate that feedback and look forward to continuing to get feedback from you so we can know how to make improvements.
Thanks so much, Kasha.
You're welcome.
So are there any, I know we have a couple of questions in the chat that we've kind of worked through and are going to be getting some answers to as well. Any other questions for Kasha or this presentation at this time? I know it's a lot of information to digest, but definitely want to be able to hold some space for you all today.
I have a really quick question, Kasha.
Yeah.
Thank you. It would be helpful for these main slides with the pie charts if that was broken down between adult and youth.
That's a good call.
For me personally, keeping it still in general terms, nothing too granular, but I think that's really important for folks right now, because either we've got expertise with youth and adolescent children or adult, because those fields are very, very different. But otherwise, thank you so much for all this information and the way you provided it to us. And I do have a billion questions, but I'll be reaching out directly. Thank you.
Oh, sounds good. Thanks.
Looks like Kasha has their hand up, or Tasha has their hand up.
It's really confusing. I did a deep dive into these into the report and stuff like that. I do have some questions regarding funding and population areas, especially in El Paso County with Divergence Health. I know there's not a lot of funding that was there, and that's a heavily populated area where there is a lot of substance use issues with like the mental health and the substance isn't matching up to the funding. And so I just have some questions with that. If you could possibly put your email address into the chat so I can write it down so I can.
Yeah, for sure.
Thank you. I appreciate it.
And just to kind of clarify, like, we have so many different funding sources that we're kind of braiding into contracts. So like some block grant dollars might be focused in a certain area where another area receives state funds. So please reach out with questions. And we just had a new CFO start a couple of weeks ago, and she's amazing. So we'll definitely be able to give more information.
Thank you. I appreciate that.
Of course.
I want to thank you, Tosh, for your kind of highlight that it seems like a lot of funding focuses on recovery sports pertaining on the substance use side, and we're doing this division of the brain, or like dissection of the brain, substance use, mental health, and not tying that together. And this has been a problem for a while now, where the majority of funding is on the substance use side, not the mental health side. And unfortunately, that continues that division of not talking about the whole brain, whole health, like we can't separate these two. And unfortunately, that's been really driven by funding. But I appreciate your call out to that. And hopefully there's, I don't know, work that can be done to bring that back together. recognize we are not, it's not one or the other, and how interconnected it all is. So I really appreciate your call out there. The other thing I wanted to mention, it was in kind of Lorraine's question around this inspectors general, or people that I don't know what other title, not that are independent from the BHA, overseeing kind of some elements of our mental health block grants. And my question is, I'm wondering if Anne, our wonderful SAMHSA TA, do other states approach this kind of oversight different? Do other states have these inspector generals, or however else we want to reference them? I'm just curious if how other states might approach this.
The monitoring.
Yeah, and just that additional oversight.
I mean, I think that because of the way that y'all use MSOs and ASOs, I think that the granular detail about performance is more buried and hard to get. The question about inspector generals, I don't have the answer for, but in terms of data monitoring, it is more common for planning councils to be able to look at data directly linked to people, and so being able to look at outcomes. That's not 100%, and it's not required that way, right? You just have to be able to address in general terms the effect of the funding, which you can approximate statistically. But I will say it's more common, perhaps in less complicated states, for people to be able to assess outcomes linked to individuals. That's the main reason that's the main difference that I see. But again, hear me, it's not required that, SAMHSA doesn't require the data to be presented that way. I'm hoping that answered the question.
I think it did. And I know other states have got this down much better and more comprehensively than we do. And I'm just wondering if there's something we could glean from how others might approach this process to capture that data.
I think other states also use MSOs, but I think that in those cases, the relationship between the state and the MSO is more prescriptive, perhaps. And again, sort of what I'm referring to is not required. So what the state is doing with the data right now is adequate for SAMHSA's reporting purposes. I think the main question that the Planning Council wants to know is, where'd you spend this money and to what effect? And I think where we've all struggled, so I've struggled since, joining y'all, where we all struggle, the state staff struggle too, is to figure out how to get a decent answer to that question, to what effect. And I think that they've, used a variety of methods to do that. And statistical modeling is one of the ones that they could use. And Kasia, do you want to talk about how you're answering those questions in the block grant report now?
I don't know that I have enough insight to speak to that with any level of expertise, but I know that the data team is coming to present to BHPAC next month, and I'm hoping to partner with them and like the reality is that we've been completing the block grant reporting, but haven't been able to do what you're suggesting and determine outcomes from that. So the data and evaluation team has a new evaluation director that
Okay.
I met with yesterday, actually. And I let her know, like, hey, we have all this information in the reports. Like, how can we make this a little bit more accessible for both leadership in BHA and
Right.
BPAC? So I don't have enough of a data expertise lens to provide an intelligent answer to this question, but I can tell you that I've raised this question to the data team, and they're excited to partner and figure out the best way to present the information.
Yeah, I mean, I think, yes, I think, are there, from the advocacy side of your responsibilities, are there significant gaps in the system that could potentially be addressed by block grant funding? That's the first question, right? No sense chasing the data if the answer is no, right? Because what the gap is has to fit within the block grant funding, and there's a, it's like a frame for assessing that. So the advocacy question, of course, unless you're extraordinary, there's always a gap. But and then you almost have to be able to say on some level that the way the funding is being spent now specifically doesn't address that gap, right? And then you can make recommendations to say, my example is always puppy sitting, right? You have a puppy sitting gap. Puppy sitting services are are fundable under the block grant. Whatever is going on with the block grant is not addressing or including puppy sitting services, and therefore the Planning Council recommends that the state, assess and pursue, take action, that the state take action to address that gap through block grant or something else. So that's kind of the logic model of how it works. What I can't do as a Planning Council member is say, I think puppy sitting is better than sliced bread, and I want the state to spend all of its block grant money on puppy sitting from now on. That's, that even though there's advocacy, there might be a gap there, can't do it that way. So the way that you use data weaving into these advocacy questions is as I described. You identify a gap, you look at, does the block grant funding allow you to spend block grant funding on that gap? The answer is yes. And you look at, how is the block grant funding addressing that gap now? It might be that they're spending 80% of their money on puppy sitting now. Can't do anymore, so you don't know. So, question 1, is there a gap? 2, is the gap fillable by block grant funds? 3, how well is block grant funding being used now to address that gap? If the answer is not well, or you can't find out, then the recommendation is that the state take action to thoroughly assess the gap and the potential use of block grant funding. And then you can, when you get that data, you can recommend that that's how they spend the money. You have a very complicated system. So I don't think I think that there's genuine heart and passion in what the state is doing around trying to make these dollars work effectively. But there are gaps in the data.
Thank you, Anne. Posh.
When it comes to the block grant funding, when it comes from SAMHSA, do you guys get really could you get details like this is specifically this is what this money has to be used for? Because I know wording is a big there's those loopholes in the wording. And so if it got a little bit more specific, it would kind of tighten the reins a little bit. That's just something that I see with studying all this data and money and where it's going and where it's not going. And yeah, to help better serve the people that need it the most.
Yeah, I think that's a great question. I mean, SAMHSA in the pie chart, the pie chart that we saw for the mental health block grant, those are the categories that SAMHSA prescribes. And within that, there are certain set asides. So like the first episode psychosis is a specific set aside. But most of it is, as long as it's spent within that general category, there is, SAMHSA does not say spend your money in recovery support services and you must spend it on puppy sitting. They don't say that. They say this amount is for this amount is for that, the rest is general. But that's where the planning council comes in, and you have a complicated system that everyone here is in good faith trying to sort out. And you want to make recommendations that will, one that the state can implement. I mean, like I said, I could say all the money needs to go for puppy sitting, and the state would say we can't do that. So it's a dynamic tension between you having enough information to make effective recommendations, even if the state doesn't like it, right? Then we might make a recommendation they don't like, but they have to give you enough information to do that. But your system is so complicated that that I don't believe anybody's trying to hide anything from you. I think that there's generally a good faith effort to spend the dollars in an effective way.
When we get questions, like, for example, with the FEP set aside, we received some COVID stimulus funds, and agencies weren't able to operationalize new sites because the money was temporary. And so we've been working really closely with the FEP program manager and the FEP vendors to figure out one-time spending opportunities. And every time the FEP manager goes to the vendor and asks for ideas to spend, they'll send me back a large list that I will then go to SAMHSA and say, is this allowable? Is this allowable?
Yeah.
So mostly it's direct services, and like anything that it seems a little like, okay, well, art supplies for a group, I don't know if that works. So then I have to email SAMHSA on those pieces. But the moral of the story is mostly just direct services to clients that meet those priority populations of SMI, SED, women with children and pregnant women, and all the priority populations of the block grant.
I'm sorry if I'm taking us back in the conversation a little bit, but I really liked Anne's proposed framework where it's where's the gap? Is this fundable, and how can we fund it? And if not through block grant, then how? And I kind of wanted to highlight an example. So as we saw on Kasha's presentation, my team and I manage the I think it's about 6.2 million set aside for prevention. And so when we look at new programs, sometimes we look at geographic data. A lot of times we look at Healthy Kids Colorado and we identify those gaps. And so in our last funding cycle, we identified 10 rural counties that had not received our funding before, that also had high risk factors. And we funded those 10 counties. In another procurement, we identified that the mental health and substance use indicators for our LGBTQ youth in Colorado are very sobering. And so we created a specific procurement for that. And we found that it's a model that really works, because then you are filling gaps, or hopefully you're trying your best to.
Right. And I think, yes. And so the role for the planning council in the middle of all of that is if for some reason the state hadn't done that, wasn't doing that, that's something that could be analyzed and then recommended. Right, if the state hadn't responded appropriately, is what I'm saying.
Go ahead, Erin.
Kasha, do we know up to this point what some of our potential recommendations have been and the state that wasn't within their, th- they said, no, they don't allow that funding. Do we already have a list thus far where that's happened?
I
Or-
have a frequently asked questions document that is kind of a working draft. Anytime I'm emailing SAMHSA, I open up my FAQ and put the response in there. I think that I could just, if it would be helpful, I think I could share that with y'all with the caveat that it is a draft and I'm still working on it.
That would be fantastic because as Anne's saying, if we also have an opportunity as a group to help the state, help their funding priorities. And if we have that ability, then I say let's utilize that. And I really appreciate that you've been keeping track of that already, Kasha. And I imagine other departments and folks working with these block grants have the same sort of thing. I think this is just a great opportunity for us to help the state as well, make these funds as accessible as possible to the gaps that we're seeing. So I really appreciate this conversation from Anne, and I would love to see that draft, Kasha. As
Yeah,
ugly as it might be, I would still love to see that.
I'll put it in chat right now.
Thank you.
Part of what it will give, I think, is a look at the sheer complexity of, you have a complex system with, different ways of getting funding out, and then SAMHSA lays over that their own complicating factors. So I'm quite sure that Kasha's FAQ is going to have some of that detail in it.
Yeah, the FAQ talks about the priority populations for both block grants and all the different regulations. And then there's a section that gets into specific allowability questions.
Right. Looks great.
Dennis.
Hello again. A lot of our approach to mental health and substance abuse is a bit wrong-headed if we really look at causal issues. Substance abuse is the result of root causes, in a lot of cases, organic brain issues. And one of the enlightening things that I've done, and I now have posted in my podcast, is I've done interviews with behavioral neurologists, and they talk about the organic impact of trauma on the brain that causes these different functionaries, such as substance abuse. So, with SAMHSA having substance abuse right on the front end, is a little concerning to me, but that's neither here nor there. What we did in our prevention committee, we looked and we drummed in the fact, and that's thanks to Bonnie and Margie and the others, the fact that if we don't address root causes, the substance abuse issue is only going to get worse. and it's not really going to be treated correctly. So again, part of what I'm trying to do is highlight the why we have these different issues come up, and what we should be focusing on. And fortunately, a number of the legislators that I'm talking to very much are looking at root causes as opposed to the causal side. So I think that's heartening, but again, we have to change our thinking somewhat as well.
Thank you, Dennis. Charles.
Hi, everyone. I just wanted to make sure I get in. I have another meeting at 11, but the state is going through a change right now, and they're bringing in ASAM 4, which is going to change all of our rules and regulations around substance use treatment. And it's been making me very concerned, and because they're talking about doing away with withdrawal management clinics. But we've had the first one fall, and I just wanted to make the committee aware that the withdrawal management in Glenwood Springs just announced they're closing due to the changes. And I think it's something we need to discuss as a council to see what we can do and recommend to prevent this from getting into a crisis situation.
Wow. Thank you for sharing that, Charles. That is absolutely shocking news to me.
Yeah.
I certainly think this is the place to have this conversation.
Can you repeat that for me, Charles?
Sure.
Thank you.
So they're implementing the ASAM 4, which will eliminate withdrawal management as a level of care. And the withdrawal management clinic they just built in Glenwood Springs like 8 months ago, announced that they're closing it. And it also has ripple effects because they're trying to move this service into, I believe, residential and crisis systems, which is also concerning because I'm starting to hear residential programs talking about closing because they can't manage that level. So I just think it's something we should try to get ahead of as a council.
Absolutely. Should we motion to put this as a primary agenda item from our next meeting, as Michael Miller highlighted in the chat?
Second.
Thank you. All right, Marjorie, and we're getting real close on time. I know we do have to open up for public comment at 55 after, but Marjorie, I want to turn it over to you. Thank you.
Thank you, Hope. And I just want to say real quickly, I think another piece is we really do have to make sure that we're talking about what's happening in communities in real time right now. I was on a meeting recently, and I'm not going to name the county, but the person was sharing the story of a LGBTQ plus young person, and who had been sober and then had always wanted to be in the military, and with the current environment has relapsed because his hope is because of things that have changed. The number of families that are not sending their children to school because they're afraid, the immigrant families. So I think we're going to see numbers, and we're going to see changes in a lot of different areas that we need to start paying attention to, because when we're tracking data on our successes, I see Phyllis is on the call. There's just a lot of things that are happening right now that we need to take care of. We talk about safety nets. This is a big one.
Thank you, Marjorie, for sharing that. And really this is what's happening in real time here. Wow, thank you. Having 1 minute until we have to move to public comment, I don't know that anybody could do what's going on in 60 seconds. So I think we've got some motions to add, already create a pretty robust agenda for next month. And I think we will ensure that we have space as well for what's going on for everyone to share. And in the meantime, any updates could be shared through email sent to Caitlin, who can disperse this to the rest of us between now and next month.
I'm putting my email in the chat for anybody who does not have it. I'm sure you all do because I am annoying too and I message you all the time. But just in case, definitely feel free to reach out if there's anything going on within your communities this month that you would like to be shared out with the council or public as a whole.
So we're open for public comment. There's been so much helpful, wonderful, informative information shared in the chat. I just wonder, I know that I haven't managed to grab everything. Do you keep track of the shares in the chat and where we can later access them? I'm sure you do, Caitlin.
Yes, I do. I've actually been copying everything into our meeting minutes for today. So if you see me like looking away and doing all of this, that's what I've been doing. So those meeting minutes will go out with the next agenda in April. So you'll have time to review those. If you need any of them before that, just feel free to email me and ask for a copy of the transcript. It's not going to be, the meeting minutes aren't going to be entirely finished yet, but I do have a copy of the chat that I could go ahead and email to people as well if they want that before the next meeting minutes come out.
Thank you. Bonnie.
Yeah, I just wanted to highlight the list that I put in the chat. So I think in an earlier meeting, I said we did have 107 applications. We were able to fund 18. You'll notice, so normally when we fund organizations, we give a description of the project. Some of these entities are serving our most vulnerable youth, and I did not want to put a spotlight on those activities during this time. I feel like this group is a safe place, and so I'm always willing to share, but I did not want to do anything that would actually endanger anyone receiving those services. So always happy to talk about it. We've also we were awarded a discretionary grant from SAMHSA. That's the Strategic Prevention Framework Grant, and we will be serving Northwest Colorado with those funds. And soon I should have a new teammate, so that'll be fun.
Thank you for doing all you guys can to protect our youth and our children right now. Thank you so much.
Tosh, I love what you shared in the chat, and I don't know if I just put it there in there as well. I'd love for you to come up and share what you wrote to kind of close out our meeting on a positive note.
I bombed the chat a lot. Are you talking about the very last thing that I did?
Your beautiful positive message about standing together.
We need to come together as individuals and as Americans and stand together and make sure that we hold accountability to the ones that are causing the harm nationwide, to all the people that depend on these services, the children, because the children are our future, and that's where, yeah. So thank you guys. I appreciate you guys allowing me to be so involved in these meetings and hearing my input. I appreciate it, and I appreciate all of you guys. So thank you.
Thank you so much. And I think with that, we will close out our March 6th, 2025 BHPAC Council meeting. So thank you everyone for a wonderful discussion. More to come next month. We've already got some really good topics to dive back into. Thank you for your contributions. Thanks, Kasha, for your wonderful presentation and for all that you do. Take good care of yourselves, and we'll see you next month. Thank you, everybody.
Thanks, everybody. Thank you, Hope.
Goodbye, everyone. See you next
Thanks
month.
again, Kasha.
Have a blessed month.
Thanks, everybody. Have a good rest of your week. We'll talk to you soon.